Utilizing over 40 years of humidification expertise, Fisher & Paykel Healthcare has designed a system to effectively generate and deliver warm, humidified gas to the patient. During surgery, the protective barrier of the peritoneum is breached. The peritoneum is the largest serous membrane in the body, forming a protective barrier that lines the abdominal walls and organs. It provides a slippery, non-adhesive surface to allow for abdominal movement, to store fat, and prevent infection. The peritoneum consists of 2 layers of connective tissue lined with mesothelial cells. Mesothelial cells are specialized, tightly bound cells which function to provide the non-adhesive and protective surface of the peritoneum. Mesothelial cells also support cell transport, tissue repair, angiogenesis, and prevent the risk of tumor cell adherence. During surgery, we take measures to maintain normal physiology to assist recovery. Maintaining normothermia, fluid balance, and pain management are all considered. However, often we neglect to consider the impact of gas the body is exposed to during surgery. During laparoscopic surgery, cold, dry CO2 is used to insufflate the peritoneal cavity to create a working and viewing space. Physiology of the peritoneum is warm and saturated with serous fluid, which is in stark contrast to the insufflation gas. As the cold, dry gas passes over the peritoneal tissue, the gas is warmed by drawing heat and moisture from the body. This process occurs at the expense of the patient, inducing evaporative cooling and increasing the risk of hypothermia. Cellular desiccation and subsequent cellular damage occurs as a result of this evaporation. The first sign of damage is shortening and progressive disappearance of the microvilli. The second sign of damage is a change in the mesothelial cell structure. The cells start to bulge and retract, breaking cell connections, which can result in cells detaching from the basal lamina due to cell death. The level of damage results in the release of pro-inflammatory and pro-angiogenic mediators such as cyclooxygenase 2 or COX-2. Increases in these factors are thought to create a pro-tumorogenic environment, enhancing the adherence of disseminated cancer cells. Cellular damage caused through cold, dry gas may facilitate a breach in the mesothelium. When mesothelial cells bulge and retract, they leave an exposed basement membrane that may promote the adherence and implantation of cancer cells and subsequent metastatic growth. Consequences of evaporative damage include evaporative hypothermia, tumor adherence, and adhesion formation. The Humigard system warms and humidifies the insufflation gas, aiming to protect the abdominal space from the effects of insufflation with cold, dry CO2. Our innovative tubing design with active heating ensures humidity conditions reach the patient to help maintain the integrity and function of the peritoneum. When the gas is warm and humidified, it helps protect the peritoneum from cooling and drying out, minimizing cellular desiccation and tumor cell adherence. Clinical evidence also shows that the delivery of warm, humidified CO2 improves temperature maintenance, reduces surgical site infections and their associated costs, may reduce peritoneal tumor metastasis, may reduce pain, and may reduce adhesion formation. Humigard, humidify to protect.